Assalamu alaikum. My name is Hafiz Muneeb, and today I am going to present about an investigational drug which is actually a combination of atorvastatin and niacin. So basically atorvastatin and niacin both are anti-hyperlipidemic drugs. So these drugs are the drugs which are actually used to reduce the cholesterol level in the body and to prevent the cardiovascular or heart diseases. First of all, the introduction. So basically these both drugs are actually classes of hyperlipidemic drugs. So we have to check that how atorvastatin and niacin works. So atorvastatin works by inhibiting HMG-CoA reductase enzyme, which is actually an enzyme responsible for the production of the cholesterol in the body. So as the main cause of the disease is the cholesterol, so we inhibit this enzyme so that the production of cholesterol is inhibited. And on other hand, niacin actually is indicated to prevent vitamin deficiencies in pediatric and adult patients receiving parenteral nutrition as part of the multivitamin intravenous injection. So niacin is actually a vitamin supplement. So the new active compound which we have been made is the atorvastatin and niacin combination. So first of all, the safety. So when we studied this combination, so we checked that the safety of the compound is very impressive, and combined use of extended release niacin with atorvastatin was superior to atorvastatin monotherapy alone in lipid profile regulation. So the combination therapy with niacin and atorvastatin was well tolerated and safe in patient with coronary artery disease, which is actually a cardiovascular disease. Moving towards the efficacy. So the combination proves to be the very efficacious in the lab studies, and overall the studies were small but indicated, obviously the lab studies are actually small, but indicated that atorvastatin in combination with niacin was efficacious in normalizing the lipid parameters, and larger lipid studies as well as the studies evaluating the cardiovascular outcomes during atorvastatin plus niacin treatment are warranted. Moving towards the stability. So we actually, with every investigational drug, we have to study the stability of that drug, either it's new formulation or new combination. So in case of our new combination, when we studied the lab experiments, the study described development and subsequent validation of a stability indicating reverse phase HPLC method. So we use the HPLC method to check the stability of the combination of atorvastatin and niacin combined dosage form. Moving toward the toxicity or adverse effect of the combination, we see that the most or major adverse experience is flushing, and it may also increase glucose levels and also increase liver enzymes and also increase uric acid levels and cause other adverse experience that may have clinical relevance in selected patients. So these adverse events or adverse experience are in selected patients, or you can say that selected animals. So this major adverse experience or toxicity is not so much to worry about. Moving toward the pharmacokinetic and pharmacodynamics. So moving toward the pharmacokinetics, this combination is completely absorbed after oral administrations, and atorvastatin is extensively absorbed by cytochrome P3A4, and it is also rapidly and extensively absorbed at least 60 to 76% of the dose when administered orally. So as this is the combination, so both the absorption of the drugs is very well tolerated after the oral administration. Moving toward the pharmacodynamics. So as I told earlier, that the atorvastatin is actually inhibit 3-hydroxy 3-methyl glutaryl coenzyme, that means HMG-CoA reductase, and it also prevents the conversion of HMG-CoA to mevalonate statin medication, decrease cholesterol production in the liver, and it can also decrease lipid and apolipoprotein B, yani कि ApoB containing lipoprotein by modulating triglyceride synthesis in the liver, which creates ApoB, or by modulating lipolysis animal studies. Dose estimation is that we use very low dose blend therapies, and which were proved very effective than individual bulk dose in rabbits. And efficiency, so it proves to be efficacious in normalizing the lipid parameter in the rabbits or animals. And its pharmacokinetic and pharmacodynamic profile is that it is rapidly absorbed and its bioavailability is around 90%. Clinical trials shows that the our drug is very well tolerated and safe to be used in the humans. When we use in the humans, so humans well tolerated it, and it proves to be safe and do not show any harmful effects. So here comes the application for the ethical approval to the ethical committee. So actually we prepare an approval letter for the ethical committee, and this ethical letter is the approval letter by the FDA of the investigation new drug application, which permit discovery to conduct clinical studies of the new drug. So we should have following required documents to attach with our approval letter to send to the ethical committee. Number one is the nature of the procedure. We should have to explain the nature of the procedure, and we should number second, we should tell about the risk and benefit of the procedure. Number third, we should tell that the reasonable alternatives, and number four is the risk and benefits of the alternative which we are using. And number five, assessment of the patient understanding of the element 1 through 4. That means actually in simple words, it is actually the consent form. We also have to approve or actually have to send the consent form with the approval letter. That is it from my side. Thank you. Allah Hafiz.